every 20 years. Alzheimer's is the 6th leading cause of death. It's the only leading cause of death that does not have a prevention, it doesn't have a cure, and it doesn't have anything that slows down the progression of the disease. That's why we're here. That's why finally there's started to be some interest, because this has developed into a health crisis. Since the first Alzheimer's drug was FDA approved in 1996, it is still our main drug. It's the only one that we've got. Not the only one. There are now 4. The last one was approved in 2003. So we have 4 drugs. Now there's some combination of drugs that we use. So a lot of work is needed to be done. In addition, those 4 drugs do not help with the root cause of the disease. They only help with symptoms. We don't have anything on the market that helps prevent the disease or actually help turn the disease around or anything near close to curing it. So this is where the focus of our interest is and our research is. Alzheimer's also has 3 legs of causes, like 3 things that we think that cause Alzheimer's. One is a background of inflammation. And we know now that inflammation also causes heart disease, inflammatory disease, cancers. So inflammation is a tremendous background noise. Second, what happens is you develop what's called an amyloid plaque. And I think of amyloid plaque as being like silly putty, where you string it around and it sticks, and it basically sticks on the brain cells and squeezes them, and they start to die. With this background of inflammation, and it creates more of a protein that's called a tau protein. It's a tangle. It's sort of like tangled up fishing net or fishing wire. So the combination of those with this background sea of inflammation is what we think causes Alzheimer's. I said this is one of our interests. We do have one study which is sponsored by Grifols, who actually sponsored this movie for you tonight. It is actually quite interesting. And when I first learned about it, I was quite intrigued because it goes after these 3 prongs. It goes after inflammation, and it goes after the amyloid plaque and the tau protein tangles. We can certainly answer more questions for you. I'm going to give you a very brief overview. It's a fairly aggressive study. So I agree with Heather. If you, anyone you love, has any symptoms or signs of Alzheimer's, don't walk to a research institute, run. Because that's really your only chance these days of turning it around for you, turning it around for the future generations, and in addition to helping science. Because we're just not there yet. We have a tremendous need and a tremendous vacuum. It's $256 billion of healthcare costs from Alzheimer's. That doesn't include the $16 billion cost of lost of work hours. This is a disease not only with patients, but our caregivers, the ones we love, that have to take off of work. So it's a social disease, it's an economic disease, and a personal disease. The current study that we have involves something that is, I think of it as like changing the oil in a car. It infuses something that's called albumin, which is in our bodies naturally. It's already been approved by the FDA. Yeah. The Red Cross uses it every day, and they use what's called a plasmapheresis. And in our office, the Red Cross comes in and takes this albumin, does what's called a plasmapheresis. To give you an idea what plasmapheresis is, it's not donating blood, but it's like someone going and donating platelets. It's a little more involved. It does require an IV. The Red Cross actually administers the infusion. And the plasmapheresis is like changing the oil in a car. So oil in a car, fresh oil in a car, helps lubricate it, helps it run, helps it hum. It also cleans those metal particles out. So when you change the oil, it's all dirty. It's all the dirt and metal shavings come out. You put new oil in, and then it helps rinse some more of those shavings out. And then you redo it again whenever your car dealer tells you to. With this particular study, you do the plasmapheresis once a week for 6 weeks, and it's monthly for 12 more months. So this is a research study. There are, in the United States, the FDA always requires a placebo arm or an arm where there's not a medication. However, in this study, you're actually on a standard of care medication. So it's not really a truly placebo arm, because you are on one of those 4 medicines that I talked to you about. The other 3 arms are 3 varying dosages of this albumin that I was telling you about, and then a second drug, which is a part of the immune system, is called immunoglobulin. And that is infused about 4 times over the year. So that's the gist of this study. I wanted to give you a little piece of Alzheimer's. The other thing that Heather talked about is when we talk about running to a research institute and being different from your physician's office. I'm an internist, been in practice, was in private practice for almost 26 years. And we give good care in physician's office. However, with these studies, you see a physician, you get a physical exam, you get blood work, you get an MRI of the brain, you get a metabolic scan of the brain with a PET scan, you get a spinal tap. With some people that freaks them out a little bit, but I'm actually pretty good at it. You get the plasmapheresis by the Red Cross, and you get follow-up blood testing, physical exam, so you actually get really, really good care. And we have a fantastic, loving staff, as you've met here today. I'm crazy about them. They're just stellar. They do fine work. They care about people, and they do good work.
Woo! All right.
So I'll be here. Staff will be here if you have any questions. Please, the other thing about the Alzheimer's is we really don't have a specific test. This memory test that I think Heather mentioned, how are we doing those?
They're signing up those sheets that we gave you. You can mark on there if you want a memory screen. We offer those free at the office, and or we will come to senior living centers as well. We have lots of, I think we're visiting several of the centers here now.
Do the memory test to get an idea of where you are and the baseline is, or send someone that you love, that you care about. Thank you, guys.